Hello everyone, I'm Anas Al-Ubaidi, and the title or the topic for this session is Practice Sessions and Certification Exam Preparations within the chapter of Review of Medical Scribing within the Certified Medical Administrative Assistant Course Program by ACMSO. Introduction. Practice sessions are structured study periods designed to prepare individuals for certification exams. Certification exams assess a candidate's knowledge and skills in a specific field. Practice sessions and certification exams serve as a pivotal components in professional growth and development across many fields, particularly in healthcare. These tools are crafted not only to evaluate knowledge and proficiency, but also to prepare candidates to translate their expertise into real-world applications. For students pursuing advanced medical scribe roles, mastering both the art of practice and success in certification exams is integral to achieving clinical excellence. Certification exams, while challenging, are designed to validate the competencies required to perform effectively in specific areas of healthcare. They ensure that candidates can meet industry standards and are fully equipped to handle their roles. On the other hand, practice sessions familiarize candidates with exam formats, identify knowledge gaps, and enhance overall readiness by simulating the pressure and expectations of real certification exams. Together, these stages help individuals not only pass exams but excel in their chosen career paths. For medical scribes, the certification process solidifies their standing as trusted professionals responsible for accurate and efficient medical documentation. Understanding medical terminologies, workflows, and the nuances of clinical environments requires focused preparation. Objectives for this lecture comprehend the importance of practice sessions in closing knowledge gaps and improving confidence, understand the role of certification exams in professional development and career advancement, learn structured techniques for effective practice and exam preparation, address challenges associated with preparing for certification exams, and identify solutions. Explore examples of how practice exams translate into clinical settings for medical scribes. Key points. Practice sessions. Importance of practice. Well, the foundation of any successful certification exam lies in well-structured practice sessions. These simulate real exam scenarios, enabling candidates to sharpen their knowledge while becoming familiar with the process and pressure of the testing environment. Identifying knowledge gaps. Objective here: recognize weak areas and strengthen them with targeted learning. Example: a scribe may find terminology related to cardiology more challenging during practice exams and can focus on reviewing related concepts. Enhancing exam readiness or readiness. Practice creates an opportunity to acclimate to time constraints and the phrasing of exam questions. Example: repeated practice with timed tests helps build the stamina to complete longer assessments without fatigue. And here is a diagram on importance of practice in exam preparation. Challenge: using poor quality practice materials can lead to gaps in preparation. Materials must replicate the structure, format, and focus of the actual exam. Solution: invest in study guides or practice tests developed by reputable organizations in the medical scribe field. Techniques for effective practice. To maximize productivity, it's critical to apply structured and flexible study techniques tailored to individual preferences. The, the Pomodoro technique explanation here, this time management method encourages sessions of focused study for 25 minutes, followed by short breaks, reducing burnout and improving concentration. Example: study and memorize medical prefixes and suffixes for 25 minutes, then take a 5-minute breather before moving on to anatomy terms. Active learning methods. Employ flashcards, group discussions, and quizzes for interactive learning. Example, form a group with peers to discuss clinical scenarios, practicing how terminology applies in context. Diver, div, Diversifying study methods, switch between reading, writing, and practice tests to prevent monotony and reinforce retention. Example, after reading about HIPAA standards, create a mind map of key compliance rules to solidify understanding. Challenges maintaining focus for extended periods can be difficult. Solution break long topics into manageable segments and reward progress milestones to sustain motivation. Certification exam preparation. Effective preparation is fundamental for success on certification exams. It requires creating an environment conducive to learning, mastering core concepts, and honing test taking strategies. Study strategies, a systematic approach, ensures efficient use of study time while covering the wide array of required topics. Organize study materials, compiling all resources such as textbooks, notes, and digital tools in one easily accessible location improves efficiency. Example, use digital tools like Evernote to categorize topics by sections such as terminology, clinical workflow, and HIPAA compliance. Dedicated study environment, eliminating distractions in a dedicated study space fosters focus. Example, set up a quiet corner with minimal interruptions as a study area. Balancing responsibilities for those juggling education and career, creating a realistic schedule is essential. Example, allocate specific hours each day for exam prep while managing work shifts. Challenge, overwhelmed candidates may struggle to allocate enough time for every topic. Solution, prioritize critical areas, weighted heavily on the exam, and allocate extra time to review those. Test taking tips. To thrive in high pressure testing environments, preparation should extend beyond knowledge and include exam strategies. Question analysis. Carefully read and dissect questions to determine what is being asked. Example, watch for best or the most likely to phrasing, which often requires critical thinking instead of rote memorization. Eliminating incorrect answers, narrow down choices by ruling out obviously incorrect options. Example, on multiple choice questions about HIPAA, exclude answers that violate patient privacy outright. Time management, allocate proportional time to each question, ensuring completion of the exam. Example, if you have 2 hours to answer 100 questions, aim to complete each under a minute. Managing stress, employ deep breathing exercises or mindfulness techniques to stay calm during exams. Example, take a brief moment at the start of the exam to visualize success and set a confident tune. Challenge, running out of time is a common issue. Solution, practice with timed mock exams to develop a rhythm for efficiently answering questions. And here is a diagram on exam preparation and execution. Challenges and implementation. Comprehensive preparation is not without its hurdles, but preemptive strategies can turn these challenges into opportunities. Technical issues, dependable access to online resources and exam platforms is a crucial solution. Test software compatibility, internet connection, and hardware before exam day to avoid disruptions. Content quality, poorly curated resources may leave gaps in preparation. Solution, rely on industry recommended materials and consult professional forums to verify resources. And here is a diagram on how to overcome challenges in comprehensive preparation. Here, challenges again in implementation, as comprehensive preparation is not without its hurdles, um, but preemptive strategies can turn these challenges into opportunities, as we mentioned earlier. Um, However, it's the same slide twice, but here's a diagram that is maybe different in design a little bit, but the same contents, as here um, 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 showing or a diagram on overcoming challenges in comprehensive preparation. Examples of clinical application. Using practice exams, familiarity with the question styles and phrasing ensures readiness for certification tests. Example, completing mock exams with terminologies used in clinical workflows demonstrates the ability to document accurately under time pressure. Study groups for collaboration, peer discussions clarify complex topics and foster deeper understanding through shared perspectives. Example, discussing specialty-specific phrases like gastroesophageal reflux disease, GERD, in group study prepares scribes to use them in real-time documentation. And here is a diagram on achieving clinical documentation mastery. Here we have summary tables for consolidation, as here a table on practice sessions, aspect description, table on certification, exam preparation, aspect description as well. Here table on challenges and implementation, challenge description. By committing to structured practice and deliberate preparation, advanced medical scribes set themselves up for success, not only in certification exams, but also in building competence and confidence as integral members of clinical teams. Next, we have the summary tables, table on practice session aspects, table on certification exam preparation, table on challenges and implementation, table on study strategies, and table on test-taking tips. Next, we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is the primary objective of practice sessions in exam preparation? A, to expedite job promotions. B, to simulate trial scenarios. C, to identify knowledge gaps and improve readiness. Or D, to reduce time spent studying? The answer is C, as practice sessions are designed to uncover areas that need improvement and prepare candidates for exams. Question 2. How do certification exams enhance professional development? A, by validating expertise and opening career opportunities. B, by increasing job stress. C, by eliminating the need for study resources. Or D, by focusing on personal hobbies? The answer is A, as certification exams serve as a proof of knowledge and skills, helping professionals advance in their careers. Question 3. Which of the following is an effective technique for practicing efficiently? A, studying for extended periods without breaks. B, using the Pomodoro technique with time breaks. Or C, avoiding structured study routines. Or D, ignoring weak areas during preparation. The answer is B, definitely, as the Pomodoro technique involves focused study sessions followed by short breaks, promoting retention and reducing burnout. Question 4. What is a common challenge during the implementation practice sessions? A, lack of access to reliable practice resources. B, spending too little time managing personal commitments. C, over-prioritizing leisure activities. Or D, revising materials too frequently. The answer is A, the lack of resources, as technical issues like unreliable access to adequate study materials can hinder practice session effectiveness. Question 5. What is an example of clinical application for practice sessions? A, studying irrelevant content areas. B, using practice exams to familiarize with exam formats. C, avoiding discussion of complex topics. Or D, disregarding the importance of group studies? The answer is B, definitely, as practice exams help candidates understand the structure and types of questions they will encounter. And here we come to the end of this lecture. Thank you very much and goodbye.